The cost of some prescription drugs for those on Medicare could come down in the next few years.
The Biden administration announced the rollout of 10 medicines that will be the center of price negotiations for the first time ever. It would help reduce spending for the government and consumers. 12 News consumer reporter Sarah Gurnelli joins us live in studio with the latest. Sarah.
Kayla, Medicare is able to now negotiate the price of some prescription medicines after Congress passed the Inflation Reduction Act last year. It would be good for consumers, but it is also being fought by some pharmaceutical companies. The federal health insurance program Medicare is for those 65 and older and for some with certain disabilities and health conditions. On Tuesday, President Joe Biden touted the new price negotiation for 10 medications under the insurance program.
Big Pharma is charging Americans more than 3 times what they charge other countries simply because they could. And I think it's outrageous. That's why these negotiations matter. Reducing the cost of these 10 additional drugs alone will help more than 9 million Americans.
The negotiation program is projected to save the government $98.5 billion over a decade. It is planned to reduce insurance premiums and out-of-pocket costs for those who are older. 12 News caught up with Senator Sheldon Whitehouse this afternoon. He called it a big day.
Announced the first drugs that they'll negotiate with the pharmaceutical industry for to help reduce costs for the Medicare program and for consumers.
Here is the list of the 10 drugs that treat a range of conditions like stroke prevention, diabetes, blood cancer, and Crohn's disease. They are some of the most common and costly prescription drugs in the country. By February of next year, the government will make its first offer for a fair price and give manufacturers time to respond. This comes as Democrats have campaigned on a promise to lower the cost of prescription drugs.
We fought for many, many years to enable Medicare to negotiate prices down with the pharmaceutical industry the way the Veterans Administration already does.
The pharmaceutical industry has been preparing for a fight. According to the Associated Press, the lobbying group Pharmaceutical Research and Manufacturers of America called the process rushed, with short-term political gain rather than what's best for patients. And the Center for Medicare and Medicaid Services aims to add 15 more drugs to the negotiation list for 2027 and another 15 for 2028. The new price negotiations wouldn't go into effect until 2026. In the studio, Sarah Gurnelli, 12 News.